Okay. Welcome, everyone. I think we are ready to start today's session. Welcome to this seventh webinar of the MediPIET at Home series, COVID-19 series. Today is our last webinar before the summer break. We will be back in September. And we are extremely honored to have with us Vicky Houssiere. Some of you already know her, the ones that were with us at the training of trainers about COVID response in February in Tunisia. So Vicky Houssiere at present works at the as risk communication officer in the response of COVID-19 at WHO headquarters. And before the COVID response, she assisted in risk communication and community engagement training with WHO headquarters and worked also as communication officers in influenza matters. So, Vicky, thank you very much for joining us. I'm gonna give you the privilege. I'm gonna make you a presenter so that you can share your slides.
Yes, hello, good afternoon.
Change role to present. That's it. We have you now in full screen. Perfect.
Can you see?
Yes, we can see you, and we also have the slides.
Yeah. So I'm gonna try to make them full screen so you can see it better. Is it better now?
Yes, now we have the slideshow as well.
Okay, great. So first, thank you for Adela for the introduction, and thank you for providing this opportunity for your last webinar for us to discuss about communication and more specifically about risk communication and community engagement in COVID-19. So first, I'd like to introduce you just briefly to the content that we will be discussing today. So a brief introduction on communication, then we will discuss about transparency, coordination, listening, and then channels and influencer. So what I'd like is to because I think we are small numbers of participants, and I know it's not always easy when we are online in a webinar, but I'd like to make it as interactive as possible, and so that we can exchange and especially hear your experience and your challenges. So there are 4 sections. So what we would try to do, and let's see if it works, is that at the end of each section that we could try to discuss a little bit about your challenges and experience. So let me start with just a brief introduction on what is risk communication and community engagement. So it's a real-time exchange of information, and this is between experts, but also between the people. And with the purpose is for everyone to be able to have the informed decision, to have the information so that they can take informed decision, and so to mitigate the impact. And how do we do that? Well, we do that by using a mix of communication and engagement strategies and tactics. So we've done several trainings with countries, and I just like to share with you this quote, which I think gives a good summary of what is risk communication. Sorry, I'm trying to read, but it's not so clearly. So our emergency response can be incredible, but if we do not communicate with our public, it will all be in vain. So everything that our emergency responders have done will have been for nothing if we do not include communication as part of our response. And so, I'm sorry, it looks like I cannot move the slides anymore. Oops, I don't know what's happening. Can you help me, Adela?
Maybe try close it and open it again.
It looks like it's frozen.
Yeah,
sorry.
your slide is frozen. So maybe close it and open it again. Let's see whether that works.
So to stop sharing, right?
Yes, okay. No worries. And now do it again.
Yeah, it's really
share content.
I've got my screen, which is
it's coming.
Something is happening.
Now we have it on full screen. The former slide. We see it. Can you?
Yes. Okay, it's back to okay, apologies. I never had that. I don't know. Okay, frozen screen with the presentation. So yeah, so we just would like to highlight again the role of communication in public health intervention, just to reinforce that communication needs to be embedded in response, but from the beginning. And here I just would like to highlight most of you are epidemiologists, and you have an amazing role as communicator. Because you are in contact with the community. You are the public health voice in the field. You have direct contact with them. You are also the first report back to the decision makers. You can have a strong influence on bringing back the information to the top. You also share data and information and coordinate with the stakeholders, the emergency. And sometimes you also have this role of with the media and providing information. So here is just to really highlight the importance of trust. And the trust is really at the center of everything we're doing. And I think that you have you see that even more in emergency, and this is really something that's crucial also here with COVID-19. And so we will go through those 4 elements: transparency and early announcement, coordination, listening, and selecting channels and trusted influencers in order to build the trust, to maintain it, or sometimes we have to do all that's taken to rebuild this trust. So first, about being proactive, it's really important for you to not wait, but to go ahead to share information and to do it regularly. And this one, you can find it different ways by doing it. It might be press briefing, the website, social media. There's a lot of tools out there, but really providing information regularly. Also making sure that you follow through, that if you said that you will provide new information every morning at that time, that you do it, or if it's once per week, it's really important to have this proactive and link for the information. Also strengthen relationship. Like we said, it's really important if to initiate it sometimes, or then to repair or build it, and not just with important, but all your partners also, for example. Be transparent. This is another crucial point in order to maintain your trust, is for the importance of acknowledging the unknown. So to say what you know, what we know in this situation, but also to acknowledge what we do not know. Also, it's crucial for announcing, for explaining what you are doing in your country. All the action, not just in communication, but in all the pillars that you're doing for the response. Describe what you are doing and show your humanity, show your empathy, because behind all those numbers, we have people, we have family. We all have people that we know that are impacted by COVID-19. So the lockdown is not probably a scientific term, but this is because it's being used all the time. So within the last 5 months, it's like 50% of the world population has been under some kind of stay-at-home order, so what we call lockdown. And depending on the time and the country, but there's been a lot of measures that varies, but that include stay-at-home, distancing, travel of bans. The schools have been closed, the office have been closed. So it's been really, people have put a lot of efforts in order to flatten the curve, and we have to recognize this. Now, countries are reopening, but this is creating also challenges for risk communication and community engagement. But it's also an opportunity to communicate about those uncertainty, all those change and discrepancy. It's for us, for the communication, the communicator to, and for you to inform the public that recommendation will change and that it will vary from time to time depending on the situation. And that sometimes, like we have seen in different countries now, that we are opening, but that sometimes we need to come back and put restriction in place again. So how to communicate about this uncertainty, which is really a challenge for all of us, is trying to provide direct and explicit communication. We need to make sure that people have the information, that they understand it, so that they can make the decision and really taking the action to protect themselves and their families and their communities. It's making sure we're telling them that recommendation would change and that it's a good thing, because it means that we are learning, that we are adapting to the situation. I mean, just remember that 5 months ago, 6 months ago, we had no idea, we didn't know anything about this virus. Also, it's important to inform the people that information will change, but it will change over time. And then then we will have to adapt to those change. Again, as we said before, it's really important to say what we know and what we do not know. And to make sure that we stay consistent in information between the sources. Like we've seen when you have the head of a country saying something and then the public health saying something else, it's really, really confusing for the population. So this is what, it's an example of how to framework the reopening. It's the risk of returning to lockdown remains there, it's possible, and that countries need to manage the transition extremely careful in a phases approach. So that's a way to explain to people what is coming, that we are not out yet, and this is phases approach. So what we mentioned is like, here are a few examples of how it's important to forecast what is ahead. So just saying that we are learning as we are going. We will have to keep adjusting and with different measures, but this is to learn more and more about the virus and how to work against it. So it's important to warn people about the potential for return to restriction, and also to be clear why we change it, what's happening. And so it's just saying, well, you know, when we getting, you know, infection again to this number, this is what's going to happen. But if we work together to protect each other, then those restrictions will not be put in place again. So here I was wondering, so if we can pause on this first element, and I'd like to hear from you about this challenge of uncertainty. So is there any of you who is facing this this uncertainty challenge, and how to inform the population about what's coming up?
So please don't be shy. You are all on mute. It's just to avoid background noise. But if you want to share your experience, just either raise your hand or unmute yourself and speak, please.
So maybe, is it something that you are using, this this technique? Are you trying to inform the population about what's happening, to forecast what's ahead? So Adela, I don't know if you see if some people are raising their hand or would like to exchange, or...
Yeah, no hand raised so far.
Okay, so we continue.
No, Lilith, would you like to share something? No, I think you. Yeah, please continue.
Okay, let's continue. Maybe with the second section about coordination. So yeah, you've noticed that especially in emergency, we have to work together. We need to ensure communication consistency. It's really important to coordinate the release of information, to make sure that when there is a new information, that all the partners or the different actors release it in the same time, so that we are all ready to inform. Like when there is a restriction, so that the different partners inform it, and step by step. It's really important also because then it's a way of optimizing the use of resources and to maximize the resources, the outreach, because you might have partners that can reach, for example, the other adult, then you have some other partners that can reach the schools. So this is why altogether we can maximize our outreach. So I'm not sure if you are working with a working group, but the way we have learned that that works together is to develop a strategy and an action plan, and to map the different capacity of the different partners, so that we know the strength of the strength and the capacity of the different run, to assign the roles and responsibility. With mapping the capacity, again, is who can reach this network, for example, who can work with the hotline. And here I'm talking about just communication, but this is something that you are all doing with the response. With the different partners in communication, it's also important to agree on who's going to speak when and how and at what time. Crucially, you've seen that before, to coordinate the message before it goes to the public. Otherwise, it creates a huge confusion. And then we can use the different channel, as we said, depending on the partners. Like the Ministry of Education, we go directly through the schools, and different partners can then outreach and work together. And so in order to do so, I'm sure you have regular coordination meeting, and that's a way also, also to update about the situation. Like if you're meeting every morning, is like, what is the situation? What is the main issues? What are the rumors that we need to answer today? Or there is a specific issue we absolutely need to talk to the media to make a press release. It's also a time where you can propose new activity. Okay, like now we are, for example, in our country, we are doing some reopening. What can we do to inform the population about the reopening? How to make sure everybody is informed? And then ongoing collaboration platforms. So to make sure that you have regular contact with all the partners to make sure that everybody is informed at the same time. As you probably have experienced, it is like coordination is not a choice. This is not an add-on. We have to, because if we do not coordinate, it will create huge confusion. We will lose trust, and then people would not follow the advice. There would be like such a confusion. They would not know what information to take and what action to do. And then it will continue to spread about the virus. Another point here is about, with COVID, it's the whole society approach. I mean, you have seen, and especially when it's reopening, it's to work with all the different sectors and to agree on how to do this step-by-step reopening. And this is why coordination with all the sectors is really crucial to avoid confusion and to make sure that we provide informed decision for the public. So just to finalize about coordination is like when all the agencies are consistent, well, also their expertise in reinforce, because when you work together and you providing, you know, the same messages, it increase accuracy. Also, when you are all speaking with the same voice, confusion is reduced and you enhance clarity. So people understand and they know better what to do if we all providing the same recommendation. Also, with all the partners getting together, we're getting a better sense of the concern of the people, and we have a better sense of understanding and what's happening and what information they need. Also, each agency, like we've mentioned, use different channel, and then we can reach out to a specific audience and expand our outreach this way. So here I was wondering if you had any questions about or experience to exchange about coordination in your country. How do you find coordination? Is this a challenge in your country, or is it now after 5 or 6 months? Is it something that's in place and that's running?
Does anyone want to share their experience? I don't see any hand raised.
No, okay.
But please, you can also unmute yourselves and speak.
No, I understand it's not so easy online, but please don't hesitate to just to open your microphone and to share your challenge or experience, or to, yeah.
Yes, I'd like. I have one comment, Günther Powoden from Austria. It was a very good coordination from the decision makers, giving press conferences on a regular basis to talk to the population. But we had a big mess regarding all the regulations. We had specific COVID-19 regulations, doctrines, and dozens, if not hundreds. And this was not easy to execute for the police, for the health services, to know what is exactly inside these regulations. So this was a big issue. And this was not communicated in the right way. And another thing was kind of lack of transparency about the source of information and the source of expert views from the government, because nobody knew who was really the consultants of the government. So there was some discrepancy between the scientific background of these experts. So this was the negative side. The positive side was there was always communication to the public on a regular basis, but there was a kind of lack of transparency about the source of information. What was the basis of their decision making? This was the negative part. This was the Austrian view.
Thank you for sharing. So now, if I just talk about my country, which is Belgium, yeah, we had this issue also. Is like when the government provided then the first opening with all the rules. Like you said, there was so many rules that it was difficult for the different sectors afterwards to make sense of it, and sometimes conflicting between the different sectors. So yeah, I can relate it to that also. One experience I think we had also was we had the voice of the government providing the restriction and the rules, and also at sometimes then we had also a lot of interviews to the experts, to the epidemiologists, to the scientifics, and sometimes they were not always aligned. So there was transparency about who was providing advice, but sometimes we had a lot of voices and then scientific not agreeing with decision taken. So yeah, we can relate to that. I don't know if anyone else would like to share about their experience about coordination, if you face the same challenges.
Can you hear me?
Yes.
Good morning. I am Maria Grazia Dente from ISS in Italy. Yes, I would say that I can share identical experience in the sense that even if in Italy there was a very good coordination since the beginning, I would say, so we were able to identify the role of each institution, of each let's say stakeholder, especially in the communication to the public. I would say also that during this pandemic, the person in charge for communication were not always on the same line. I don't know, maybe you had some chance to see what Italy was communicating during the pandemic, and really there were very far positions, even in the communication to the public. So to sum up, I would say that the positive case was that between, let's say, all the entities involved, there was a very strong coordination with a leadership that was guiding and is still guiding the process. On the other way around, the negative, let's say, aspect was that everyone was saying in public the view, what they were thinking about the epidemic, and their view were not, many times were not aligned. This is my impression regarding Italy. Thank you very much.
Thank you. Thank you very much for sharing your experience. I mean, it's also important to say that, you know, when we look back, we can see and we are learning, but at the time we have also to recognize it's a very, very challenging situation. But I guess we're learning every day. So yes, thank you for sharing your experience. Maybe we can move now to the third element that also it's important for building or keeping our trust is listening to the people, to the population, and to what they're feeling, their perception of risk and how they're living it. And why is it important? Because it's important to understand if the restrictions are working, if the advice that we are providing are followed, and if it's working, in also to inform the decision. So to get to hear and to get the feedback and to see, okay, now we have this information, we can take the decision and we can move on for a new restriction. It's also helpful for us, the communicator, to revise our messages to see if this one resonates or not to the people. To look at the strategy, how to reach the community, and to see the new challenge coming up, because we always, I mean, it's going very fast. We have to see that the situation is evolving very fast with misinformation. We have stigma, conspiracy theory. So we really need to be up to date so that we can react quickly to counter this disinformation on others. And also it would help to inform for further action. And how do we do that? Well, we listen through, I mean, like you do through the news, through the traditional media, also to the social media. I'm sure like it's, the social media have taken during this pandemic a huge space. And like you have said with internet, like everybody now has his opinion. And so it's a lot of noise out there, but we need to listen so that we can hear what's happening. Telephone lines is a good way also to get feedback from the population, to hear the concern and the information where it's like, hey, this one we don't understand, or we would like to know what's happening here. What is this virus? How long does it last? What is the immunity? Also, there's a lot of surveys happening. So what we're finding here, the issue is to not only to collect those data, but to take the time afterwards to analyze them and to use that to inform our response. Community engagement feedback, and also listening to our partners from everything that also they are hearing as data and information. A partnership is crucially so in this implementation of listening. Universities can help with survey. Private research organization can help with, you know, the outline and everything. The market research and also the UN agency. So also for listening, let's try to make sure to have a very coordinated approach. Here is a challenge I'm sure that you are probably facing also is this fatigue of this pandemic and the COVID-19. And it's like people have done a lot of sacrifice. They've done a lot of effort. They have put a lot of their life on hold, and they want to go back to normal. And so this is our role here in communicating, in how to help people move forward with this, what we call this new normal. So this new life, and to help them to re-engage with some activities, but not all. So where we have to say, well, this is something you could do, but make sure that you take those measures, make sure you keep your distance, make sure you wash your hands, make sure so that they go back to their activities, but with a different behavior. Also to tell them, well, you know, this is okay to do. You can go to public transport, but then, for example, according to your national policy, you must. And also that, you know, to support this positive behavior. So helping people to find there's those new tools, how to adapt. For example, in some countries, they were for the distance, in order to keep the distance when you're shopping, they have used the distance of a card. So it's, they put marks on the ground. So it's finding different tools that are helping people to go back to this new normal, which is still to keep different behavior. one way to do it also is to directly address this fatigue and to say to people also that we understand those restrictions have been hard on you and they've been hard on me too. So make it personal, and that, you know, we be able to work or to spend time with family and friends, but you need to keep your behaviors. We understand you're tired of this, but we can go all of us through this together. Also, it's important to thank people for their action, to recognize that it's been difficult for them, but that all of us together and each one of them, then we can, you know, make sure that the numbers of infected people will not come back again up. So here I was wondering also if you would like to exchange maybe about your challenges about the fatigue of the measures in place in your country. How are you managing to inform people and to keep them committed and motivated? Is there any of you who'd like to discuss about the fatigue in your country?
I don't see any hand raised, but please don't be shy. Unmute yourselves.
No, for example, what just another example that I forgot which country it was. I think it was in the Asia, Southeast Pacific. It's like people were like, after, so listening from the surveys, like people would not hear about COVID-19 anymore. They did not even want to listen to the news or anything. So what the country has done is to talk about those measures, but without mentioning COVID-19 or the virus. It's just like saying, hey, this is your new life. This is what you should do. This would protect you and protect your family, but without mentioning the virus. So here is just what one country has done to address and counter this fatigue. Okay, there's no
hand.
Okay, let's continue. So this is the last element to continue to build trust, and it's about community. So outbreaks begin with one person in one community becoming sick, and this last sick person becoming well. So we need to make sure that this pandemic cannot be managed without the support of the communities. And we're talking about the different communities. It can be an online community, it can be a sector, but in order to reach those different groups, it's important to map them and then to try to recognize who we can work with in those different target groups. So think about the health workers, celebrities, the leaders within the community, if it's a religious leader or in a sector, trusted source, like we were talking, if it's a scientific, well-known, or within the local authority, if it's the mayor of the town, but also testimonies. So people that have been through COVID, for example, and that have survived it and the impact it has on their life. This is one example that was used here, is to ask influencers to do the safe hands challenge. And that has worked very well, trying to link with influencers. So for different target groups here, for young people, and to ask them to share their experience, but with positive. So what can you do? What action can you take? And so work with this media influencers. This is a challenge that has worked very well here. This is probably a good reminder at the end, is like, we're providing examples or ideas, but we need to adapt it to the different countries, sometimes to the different regions, depending on the situation, to adapt to the different people, to the different groups, to old people, younger people, to people who have been who have recovered. So it's, remember that, you know, it must be tailored to the situation, and the risk perception of the people is how the people have been through this and how they are understanding their risk. But also just take that as an opportunity. So every interaction, every time you meet a person or a group, it's a chance to build and to maintain trust. Oops, I think my screen is frozen again. I'm sorry. I don't know what's happening. So, okay.
Yeah.
Yes, back to normal. So, this is the last slide. This is probably the conclusion, is to build trust. Risk communication and community intervention should be transparent, timely, as we've mentioned before, easy to understand. A crucial point is to acknowledge uncertainty. There's many things we don't know, but this is what we know, and this is what we can do to address the changes, that it's an evolving situation, and it's good if it's changing. It's good if we are evolving with the science and if the recommendations are changing, because it means that we are learning about this new virus. It's important to address the affected population with empathy, to link to self-efficacy, and to use different platforms, as we said, different methods and channels. So this is the conclusion for those elements about trust and risk communication and community engagement. So maybe we have time now for some discussion, or if you have questions or would like to share some of your experience.
So please, you have two options for the questions. Either you can just unmute yourself and pose the question yourself, or you can also use the chat if you want.
Yeah, I can see the chat too. So I've managed to see the chat without freezing the screen, which is good.
Is there any question? Anyone who would like to share their experience during the COVID-19 response?
How is trust for you? I mean, trust in when you're providing messages. Is it, do you want to mention anything about your country experience with the trust in the government or in the scientific, or? Hi, Concha. I can see you raise your hand.
Oh.
You are mute now. Yeah.
We cannot hear you. Wait, I'm gonna try unmute.
Now you are unmute, Concha. I don't know if your sound is on. And we have also another hand.
Cesar, you are also unmute.
Hello?
Yes,
we
hello.
can hear you.
Hi, Vicky.
Hey, hello.
Just one question. It's about the messages we are sending from the beginning of this COVID issue. Here in Spain, I think we made a job with Fernando.
Cesar, could you please speak louder? I cannot hear you very well.
Okay, from the
Yes.
beginning, okay?
Yes, please.
I think in Spain we have a very good job as communicator with Fernando Simon as a speaker.
Yes. Yeah.
But we have several problems, I think they have, with the messages we were sending to the people from the beginning of this COVID issue. It was messages like were also in Brazil, like it was going to be like a little flu, or messages that were sent in Spain, like it is going to affect few people, and we will have few dead people after this COVID issue. Now all these messages are sent and published in the social media, and they come again and again, and they are shooted to Fernando Simon or government, saying that you said this, and now happened something very different. How can we deal with these messages we sent before we know we knew more about this COVID-19?
Yeah, so this is a challenge that we all facing because the situation is evolving, and this is why we mentioned that now when we post a message or when we post a video or an infographic, we need to make sure that we put the date on. And this is one thing, we need to date everything to make sure, because things are evolving so quickly. The other thing is really to keep on informing the public that this is a new virus, that we are learning every day, and that what we've said 3 months ago, since then we have learned a lot. This is why there's so much research ongoing, and that it will keep on changing. We're hoping to get more information, more scientific information that would help us to find treatment or to continue to evolve. So yes, what was said 4 or 5 months ago, it's probably not valid anymore, but because it's a new virus, we have to say to people also, we've been through this before. We had Zika, which was also a new virus that emerged. But what's happening here with COVID is that it's going really fast in terms of information, but we are also learning very quickly, like we've never done before about the virus. So it's really reiterating this evolvement of science, I think. But yes, it's a challenge. Yeah.
You?
We have also a comment by Concha. I guess, Concha, can you? If not, I will read it. The idea is related with the communication of the uncertainties to the general public. Public wants facts and is not educated on the scientific management of the uncertainties. So how can we educate the public? How can we communicate that not everything is known at each moment during an epidemic?
So this, yeah, thank you, Concha, for the question. So what is important to do is every time when we communicate and to say, this is what we know now, this is what we've learned now, but you know, this might change. So this is what we know, and this is what we don't know. And maybe in a week of time, we will know more. So it's to be really transparent, I think, to communicate often, but to be very transparent about what we know and what we don't know. Like the mistake maybe that some countries have done at the beginning, it's downplaying, say, oh, that's fine, it's not, you know, it's a small virus, it's going to go away. I don't think that anybody would say that anymore now. So it's just saying, we don't know. This is what we learn about, you know, this virus, about, for example, the symptoms. We are learning every week about the symptoms. Those are the symptoms that we know today. But research is continuing. And maybe in a week time, we will have more symptoms that we know on our list. So yeah, this is what would be to be transparent and to inform that we are learning every day with new information and that it's evolving and it will keep on evolving. I'm not sure if it's answers. Thanks, Concha, for your question.
There was also a comment by Gunther, so I have unmute you if you want to comment yourself.
Yes, can you hear me?
Yes.
Okay, it's like this very situation was very difficult as there were so many diverging studies. For example, if the community masks are working or not, even at WHO level, at the beginning they said, no, we don't recommend using these masks because of some issues. Then they changed their mind. Also, the Robert Koch Institute in Germany, same issue. So it's also difficult to create trust if you have so many diverging opinions on a specific subject. So the challenge is, I think, to address the pros and the cons and the opportunities, and that you have to take a decision in the end, and to say, okay, we plan for the worst, and that's why we introduce these masks, even if we don't really know if they are working or not. It's just a precautionary measure, and that is very important to communicate it like that, not say yes, so it is, and eat it. We don't accept any discussions. You should really address all the aspects, also the positive or some other maybe contradictory scientific opinions should be also addressed. But then we have to take a decision, and our decision is like that because we think we should plan for the worst, so we introduce these measures. So this is, I think, the challenge of the decision makers to keep this trust alive. They don't neglect the other, even if their opinions are not in their mind and not in their direction. So this is the challenge that they see. Put on the table what is there, and then say why the decision was done like this.
Yes, exactly. So I think your last point is very important, is to say, why was this decision taken? And yes, a scientific will probably advise a certain decision, but then the decision maker that's running the country might decide, here, no, I'm going for this one because we want to go for the precaution. And if we don't have all the science behind us. So yeah, as long as, I think, like it was said before, if the decision makers explain why they have taken this decision, so that people will follow them, I think. Yeah, it's so challenging. Yeah, I agree with you.
Any other comment or question? Is your last chance. I don't see any hand. Angeliki has raised her hand. I'm gonna, yeah. Please go ahead, Angeliki.
Yes, now you can hear me. Hi, Vicky.
Hello.
Hi, thank you for joining us in this webinar. It was your presentation was really nice. What I wanted to ask you, it doesn't apply to the community, but I like that you touched upon the issue of the COVID, of the pandemic fatigue. But I would like, you gave us some tips about how to deal with that with the public. What would be your tips, let's say, with the public health and the health professionals who are having this pandemic fatigue, not necessarily in their bodies, I mean, like with tiring because they work long hours, but they are like, okay, they are sick of COVID, let's say, because they are dealing with it like in long hours every day.
Yeah, so you mean for the healthcare workers, right?
Yes, exactly, and the public health workers, not only the healthcare.
Yeah,
yes.
Yes, yeah, totally. Yeah, totally. It's we can feel that. I think I've read also a lot of articles about the country saying, yeah, our healthcare worker or health public workers are really tired, and it's really time to search and to get more resources to help. I think that was one of the fight, that more resources needs to be given to the health sector and to the public health sector, to support these people that have been giving so much of their time and their health and sometimes their life. So it's really time for recognition and more support on that side. I don't have a special trick, but just to
I guess
to encourage the government to support and to see the importance of the health workers.
Yeah, definitely. But I think what you are saying, I mean, of course, this applies to the directors that can also be tired, of course. But until that happens for every country, that usually the funding or the more resources, especially in some countries, are not coming very fast or very easily. So they might come after the pandemic has ended in some cases. But I'm just saying, even for the directors should acknowledge and then give some positive feedback, like in more intense ways, I would say. That would be a good tip, I guess, for all the directors out there.
Yeah, exactly. I hope we're gonna get a lot of, good lessons learned, and that that maybe now after 6 months, countries can, look at what's needed to make sure that, this doesn't happen again. Yeah.
Mm-hmm. Yeah. Thank you, Vicky.
Thank you very much, Vicky. So I'm going to give the floor to Isabel Noguer, who is MediPIET scientific lead from Carlos III. I think she has a comment, and she will also do the closing of the session.
Thank you, Adela. Thank you.
Thank you, Adela. Yes, indeed, I have a comment. Thank you very much, Vicky, for your presentation. I would like to, I have not a question, but rather a comment. I think to highlight some positive things regarding this pandemic. For example, we have more knowledge transfer from research to public health practice than ever, I think, because we have shared with scientific people, with researchers, with decision makers, the last issue, the last publication that has been distributed regarding whatever, mask, prevention measures, whatever. So people has been really updated with this epidemic about the last discover in the scientific publications. So, but I think that our decision makers, I'm speaking about all countries in general, I don't know if our decision makers have been updated as soon as the researchers provided that information to explain to the general population what this discover means. I don't know. I have very good examples in Spain, but I don't know worldwide. I would like you to explore, you to explain us about a bit about this.
Yeah, so I mean, it's really nice also to hear positive outcome also this pandemic. It's there's been an incredible also partnership. Also hear about with the acceleration fund here for vaccine is being, there's an amazing amount of researchers working together, putting their priorities in order to accelerate all this research. I think it's never, like you said, it's never been so many exchanges so fast in order the research to move so fast. So with the research, how it's communicated you mean to the countries? Was it your question, Sabina?
My question is about the translation in the decision-making practices in different countries. I know what happened in Spain, in my country, but I would like to know the experience from other countries in this knowledge translation.
Mm-hmm. I guess it varies very much from, like you said, from one country to another one, but so many human resource and resource has been put in that. I know that here at WHO, so they have this RD blueprint. So those are this initiative to share information very quickly between the researcher. And the member states, for example, are updated here every week. But then I guess, yeah, then what the member state then after, how each of them afterwards translate that to the public, I guess it depends very much from one country to another one.
Okay, thank you very much. So if there is no other contributions or...
There was one last comment, sorry, just to mention, I will read it. It's just, to a certain extent, the political power in its decision-making has a lot of difficulties to understand the existence of scientific uncertainties and therefore to integrate them wisely without putting pressure on the scientific community.
Yeah, I guess this is also related to vaccine, right? Saying that, you know, we're going to have a vaccine in 6 months, or we're going to have, so that, you know, raising expectation for a vaccine. Yeah, I guess that's, you know, for that was probably a few months ago where the politicians were putting pressure on scientific to find a vaccine and saying that that would be the solution. I think that now we're speaking a bit differently and really relying on public health measures. Yeah.
So thank you very much, Vicky, for this session. I will give the floor back to Isabel.
Okay, thank you. Well, this is, so far we had 7 webinars with the participation of leading experts covering a wide range of areas for early and comprehensive response on COVID-19. This will be our last webinar for this time. We will go back to our webinars later on after the summertime. Most topics were selected according to fellows, alumni, supervisor, and national suggestions. Those preferences were provided in an online survey in February, March 2020, made by the MediPIET team. And after summertime, we will change and we will have another initiative. We'll carry on with the new format and exchange on their COVID-19 experiences. It will be exciting and interesting for all the MediPIET family. And well, just to finish, we keep looking forward to meeting you and your new initiatives after summertime. And I wish you have a nice and wonderful and I hope to see you all in September. Thank you very much. Thank you, Vicky, for this wonderful presentation. I hope you to join us by the second version of MediPIET webinars. Thank you.
Thank you very much. And thank you to all of you for your time. I know that time is really precious at the moment. So thank you for giving an hour of your day to discuss about communication. Thank you so much.
Bye.
Bye-bye.
Bye. Thank you to all for your participation. See you in September.
Thank you, Adela.
Ciao.
Ciao.